Hi, I'm Tom Maer's, and I'm pleased to welcome you to the Anatomy Trains Technique series of videotapes. These tapes are designed as a memory aid for any of you who have been in my classes before and would also be suitable for any manual therapist who wants to add fascial plane release techniques to their structural repertoire. These tapes are specifically designed to give you the feel, the kinesthetic feel of these fascial and myofascial releases, and as such, they come with a few cautions and a few suggestions. The first caution is that these tapes are long on technique, but short on both anatomy and assessment. In terms of the anatomy, we covered this in tape 2 of this series, the Anatomy Trains Overview. It's also covered in my book on the anatomy trains. Well, if you don't have either of those, you can follow along with a good anatomy atlas of your choice. Though we will do a little bit of assessment with each tape, the judgment of when to use each of these techniques is really left to you. You can get more help with the assessment in the Anatomy Trains book, again, or in tapes 3, 4, and 5 of this series, or by attending any of a number of structurally oriented classes, such as those we offer at our kinesis school. Believe me, I am very aware of the limitations of trying to teach these techniques, which rely on your kinesthesia and your sensitive perception in the body via a medium which is totally visual and auditory. To ease this, we have created a kind of classroom situation in which you'll see me demonstrate the techniques, but you'll also see a student imitating the techniques and the client comments on how we get there. I think this will make it easier for you to recreate the feeling of these techniques. Though we will be showing you the techniques in some detail, we're not interested in your slavishly imitating them exactly as they are on the video. These are, call them templates for techniques. They can be applied in different ways to suit particular clients and particular problems. Once you get the feel of the technique, you can work creatively with it to apply it in many different ways. And we hope that's what you'll do based on what you see here. For ease of learning, we're going to start at one end and work our way up to the other. In practice, this may be the way that you work. It's an okay way to work, but it's certainly not the only way to work by any means. You might start with an area that is particularly held or particularly tight or short and work out along the line and in both directions from there, and then return to this difficult area toward the end of the session. So what we're going to show is a way, but not the way, of approaching this myofascial meridian. We hope that you enjoy and learn from these videos. Of course, we'd love to see you in a class also, since the learning is often better face-to-face and hand-to-hand. But let's see what we can do with this electronic medium. Okay, with those general considerations in mind, let's get down to the specifics of the superficial back line. We're going to review the anatomy here. The anatomy is much more carefully reviewed in the second tape of this series, the Anatomy Trains Overview. But just quickly, we're going to see that the superficial back line covers the body in two major pieces, one from the bottom of the foot up to the back of the knee, and the second from the back of the knee all the way up the back of the body, over the top of the head to the forehead. The first section starts at the bottom of the toes. That's the first station, and the first track is the plantar fascia that runs across the bottom of the foot. I bring your attention to that lateral band of the plantar fascia as well. And that brings us to the second station, which is the heel. The fascia rounds the heel and comes up the back of the calf in the soleus and gastrocnemius. The tendons of the gastrocnemius at the top intertwine with the bottom tendons of the hamstrings. And the hamstrings are the next track, which carry us right up the back of the thigh, of course, to the ischial tuberosity. If we're looking for a muscle above that, we won't find it, but if we look fascially, we will find the continuation of the hamstrings is the sacrotuberous ligament, which leads us right up onto the sacrum, onto the sacral fascia. And the sacral fascia, of course, is the originating point of the erector spinae, and the erector spinae travel right up the body, up the back, in long expresses and locals up to the back of the head. Now again, the muscles stop, but the fascia doesn't. The fascia continues right up over the epicranium and the gallia aponeurotica to the brow ridge on the forehead. So that's the territory of anatomy we're going to cover with the techniques for this line. So let's just spend a few minutes with the meaning and the function of the superficial back line, and then we'll get right down to the techniques. Okay, if we think for a moment about the function and significance of this superficial back line, the first thing that comes to mind is it's the line that holds us up. If you look at the body here, the tendency of the body is to fall forward into flexion, into the fetal curve, and it's the back line, it's the superficial back line, the muscles of the superficial back line along with its fascia that brings us up upright. Therefore, this line contains a lot more slow twitch fibers that are firing more all the day, the sort of dark meat of the chicken, versus the front line that has the quick fibers that brings us down. So there's this fight going back and forth between the front line and the back line, and you see this all the time in bodywork practice, and it's always part of structural bodywork. But if you look at what happens when the body gets brought up in this way, the body starts in a fetal position with a fetal primary curve. And you can see that primary curve going right through the spine. But as we grow up and stand up, we get two secondary curves in the spine, the cervical curve and the lumbar curve, so that you have the secondary curves in the cervicals and lumbar and the primary in the thoracic and the sacrolumbar. But if we think of this in an anatomy trains way, extend this idea. What's the cranial curve? The cranial curve is primary. The cervical is secondary. The thoracic is primary. The lumbar is secondary. The sacrococcygeal is primary. Keep that going right down the legs. The knee curve is secondary. The heel is primary. The arches are secondary. In a way, this may be stretching a little bit to take the primary and secondary curves beyond the spine, but the superficial back line essentially goes along a wave of primary and secondary curves, from the arch of the foot to the back of the knee and up to up the entire spine. The interesting thing about all of the secondary curves, the arch, the knees, the lower back, and the neck, is that they're all held in place by the balance of the soft tissues. And so our work with the superficial back line is to bring these curves, helps to bring these curves into balance. So if we just look at this picture of a little girl, you will see on the left that she has her knees hyperextended. This is before she had any work, and we'd call this hyperextended knees. But if we look at this with an anatomy train's eye, we could say that what's happened is she's taken what should be a secondary curve, the natural flex of the knee, and by hyperextending it, turned it into a primary curve. And look in her body at what happens. She has to compensate for that lack of a secondary curve in the knee by making more curve in the other two secondary curves, the lumbar curve and the cervical curve. Now, she or some adult client might come into your practice talking about pain in the lower back or pain in the neck, and if you just worked on the lower back or the neck, you'd miss the pattern, you'd miss the bigger picture. So the picture on the right shows her after structural processing, and you can see that what's happened is she's let the knee go back into a more neutral or natural or flexed position, and the result is that her secondary curves, the lumbar curve and the cervical curve, have taken a more neutral, natural, normal, happy place. So as we go to work with these techniques on the superficial back line, I'd like you to keep in mind when you assess your clients that what we're looking at is, in its rightful function, the balance of the primary and secondary curves along the back of the body. So let's go from here and take on some techniques. So the superficial back line, starting from the bottom of the foot, goes around the heel, up the back of the leg on the gastrocnemius and hamstrings, the sacrotuberous ligament, and up all the erector spinae muscles and fascia to the back of the head, over the top of the head on the scalp fascia to attach to the brow ridge, and on its way covers all these primary and secondary curves on the back of the body. So let's get started with the superficial back line. The first track of the superficial back line is the plantar surface of the foot, which begins at the toes, stationed at the toes, and goes back to the front of the heel. And if you look at the bottom of the foot in structural terms, you'll see that there are three main points of support: the heel and the ball of the fifth metatarsal and the ball of the first metatarsal, which creates a triangle under the foot. And there's an arch between each of these points: the lateral longitudinal arch on the outside and the medial longitudinal arch on the inside, and the transverse arch between the ball of the first metatarsal and the ball of the fifth. So our first work on the bottom of the foot is to open up each of the sides of the triangle here to help make the arches pliable and strong. Hi, so we're looking now at Kim's athletic and nursely foot, and it's got a nice high arch to it, and here's the heel and the ball of the fifth metatarsal and the ball of the first metatarsal. So we're going to work particularly along this outside edge. I've taken a little lotion so that I won't skitter across this tissue on the bottom, and I'm going to work down from the outer edge of the heel along the outer edge of the foot towards the base of the first metatarsal. I'm having to work through all this tissue, so I'm pressing pretty hard. How's it doing for you, Kim?
Feels nice. It's a sense of release beginning already.
And as I work down toward the fifth metatarsal, I might feel a few crunchy things under my hands. Generally, those calcium lactate bits will just melt away as you work. You don't have to use a knuckle. You can use fingertips. We're going along here, but the idea is to create length between the outer part of the heel and the base of the little toe. Similarly, we can move from the inner part of the heel to the base of the big toe along the inner arch, and just to make the plantar fascia a little tighter along the inside, I'm going to bend the toes into hyperextension so that the plantar surface is a little bit tighter. If I want it to be looser, I can bring her toes into flexion. Then maybe I can go and get the deeper tissues. But if I want to get the superficial tissues, which I do in Kim because her arch is high and tight, I'm going to bring the toes up and using the surface of my knuckle on the inside very slowly, because this can be quite sensationful, just bring the tissue down towards the ball of the foot in the arch. Always feeling with my fingers, feeling with my other hand. And Kim, why don't you work with the toes a little bit? Bring the toes up and down and up. Good. And now across the arches, across the transverse arch here, across from one ball to the other ball, the metatarsal heads, just behind the metatarsal heads. I'm not right on it, but I'm just behind it. And again, I'm going to use a knuckle here, and I'm going to bring it across the distal transverse arch, opening up between each metatarsal head. You can go from lateral to medial or from medial to lateral. I just find it easier to go from lateral to medial. So with those three, we have gone in between each of the points of the arch. There remains the middle part of the plantar fascia, which if you just take a 3-knuckle spread and go just in front of the heel bone, there's no point in going all the way back to the heel, but if you go just in front of the heel bone and down the arch, and I'm going to ask you, Kim, to slowly dorsiflex and plantar flex at the ankle this time. Yep. Is this still within your tolerance, Kim?
It is. It is sensationful, though.
It is sensationful. That's good. Okay, and lift your foot up again. Dorsiflex. And I'm just keeping my hand there, and I'm trying to stay in that sensationful place without going into the painful place. but the bottom of the feet are very sensitive and very tough, so it's a conundrum of a place to work. How do you get through that toughness without creating too much on the sensitivity realm? But you can see that the foot has some nice mobility in it now. That's good. Now let's let Jeanette try. So now let's see how Jeanette does with these techniques. And Kim, you can tell us what Jeanette's doing compared to what I was doing. So go ahead and start down the outside edge of the foot there.
With two
Yeah.
knuckles?
Yeah, if that's what's comfortable for you, that's...
And am I going in pretty deeply, or?
You're going in pretty deeply, and Kim will tell you when you're getting towards that deepness. The only thing that I would recommend is just bring her foot a little bit into dorsiflexion as you do it. Can you feel the tissue moving in front of you? That's one of the...
Yeah, I can now. It's a little thick.
Yeah, it's
more
thick.
Towards the heel. But
But you can feel it now.
Yep. How's the pressure on that, Kim?
The pressure's good. I can feel the tissue moving as well.
Good, and you'll carry that right on down to the ball of the little toe.
Some sensitivity in that area there.
Yeah, I could feel that. Do you want me to
Good.
lighten up?
It's okay. It's right on the line.
And you'll feel that you just kind of run out.
There, yep.
Right there
Yep.
at a certain point. Yep. Okay, good. Try that down the inside of the foot.
And am I using my right hand for that as well?
Well,
Or?
try using your left hand.
Okay.
Build you up a little bit.
All right, and can I use 2 fingers?
You can use 2 fingers.
Okay.
But you know what? You're not getting in there with those 2 fingers in the same way. That's my guess. How does it feel like, Kim?
It's different. It's more superficial.
Yeah.
Okay.
So let's turn her leg a little bit in to give you a little more leverage. Yeah, and you
And
can
I'm starting right there.
You can start right there. You can rest your hand on your knee if that helps you. Good.
How's that, Kim?
Much different.
Yeah.
You're in
Does
there.
that feel
much-
better?
Yeah, I
Yeah.
feel like I'm going in much
Okay,
deeper.
now Kim, begin to move your toes back and forth. May you feel the change in the tonus as she
Oh,
does
yeah.
that? Yeah. That will help keep you in the right place if she keeps moving. Great. And again, you'll find a place where you just run off the end.
Right there.
Good. Okay.
How was the pressure on that, Kim?
That was good. You lightened up a little bit towards the end of that stroke, but you went into it very nicely.
Okay, so Jeanette's using her thumb on this, which is not what I do, but it's what she does, and it's working for Kim, so it works for me.
How about that? Was that better?
That was better.
And finally, if you could just try the 3-knuckle thing with your right hand and just come right down the plantar surface. Yep. And this time, if you have her dorsiflex and bring her toes up, if you use your thumb here to bring her toes up, there you go.
And am I bringing it back up?
Are you bringing what back up?
Her foot back up.
No, she'll do it. She's
Oh, okay.
dorsiflexing. When she, try this again. When she dorsiflexes, bring this right up against the table. You'll feel that drumhead of the plantar surface tighten. Yep. And so that keeps you on that surface. As long as she's doing that, you can feel exactly
yeah.
where it is. There you go.
I feel like I'm not getting my first knuckle in there as deep.
Well, yeah, the second knuckle is the one that gets the deepest.
Yep.
Yeah. Yep. Was that okay, Kim, or was that too fast?
No, that was very good. You had nice pressure.
So just to add one other technique in here while we're here, going from the outside edge of the heel to the base of the 5th metatarsal, right between my 2 fingertips, is the lateral band of the plantar fascia. And I've gotten really quite excited about this small piece of fascia over the last couple of years. I suppose you have to be a little bit crazy to get excited about such things, but I do. You cannot really work this from the bottom. So I'm going to turn Kim's foot so that you can see I'm coming in from the side. There's almost a ½ an inch of connective tissue covering over this lateral band. So here's the 5th metatarsal, here's the edge of the heel. I'm going to come in from the side and then turn my hand and come up under. That's different from coming up through the bottom of the foot. I come from the side and then come up under the plantar fascia. And Kim, can you feel the difference when I
Yes.
contact this piece?
Mm-hmm.
And then by bringing my elbow up, I move my fingertips down to get this. Just from the outside edge of the heel to the fifth metatarsal. That's all there should and could be for this piece. You can also do it with a knuckle by coming in from the side and then turning under so that you come up under this small piece. And you can see how slowly I'm working it because it's a tough piece of gristle and we're opening it up. This is very valuable in people who have a fallen medial arch. Even though you're working on the lateral arch, it's going to help people with a fallen medial arch. And many, many people where you see that the little toe and the heel are too close together could use some lengthening in this lateral band of the plantar fascia. So now let's go on to the lower leg. The next track of the superficial back line includes the gastrocnemius and soleus here on the back of the calf. And since the tendency of the superficial back line is to hike up, we're going to bring it down. I'm going to place both hands, again with this soft, conforming, non-fist, open-handed fist, on the back of the two heads of the gastrocnemius, at least an inch or two below the knee. And then I'm going to bring my weight over my hands so that you see my hands are almost vertical, or if not past vertical. And then by leaning into my hands, it's not strength that I'm using, but weight. By leaning into my hands, I'm going to bring this tissue down the back of Kim's leg. Okay? But the method is put it where it belongs and call for movement. So we're bringing it down, and now I'm going to ask Kim to dorsiflex and plantar flex. I've got her leg far enough over the end of the table so that she can dorsiflex and plantar flex without hitting the table. And as she dorsiflexes and plantar flexes, I can clearly feel. Now I'm narrowing my field of focus to my index knuckle here, my inner knuckles, as I come down, as this whole structure gets narrower. And by the time I'm down to above the ankle, it's so tendinous that I'm not going to get much length. I'm going to get the predominance of length through the middle of the structure. So once again, just putting my weight onto, not my strength, and just bringing the tissue down as she moves up and down with her foot. Do a little more movement than that if you would, Kim. Really dorsiflex and really plantar flex. Really dorsiflex, that helps stretch it. That's great. Okay. Okay, so let's have Jeanette try this technique. So you've placed your hands below the knee.
And I'm keeping them
Yep.
open, or am I doing
No,
a good
you're
fist?
you're keeping them open so
Yep.
that they conform nicely in.
Yep.
Push down on your back foot.
Mm-hmm.
So you lift yourself over your arms. So you're a little bit past your arms. Yeah? Now you can lean on them and it will just glide down Kim's leg. Do you feel?
Yep.
Yep. It's great. Now, what have you forgotten? She's got to move. So...
Oh, that's right. She's got a dorsiflex.
Dorsiflex and plantar flex, yep. Okay. So just for once, try it with leaning back.
Okay.
Now try bringing your hands down with that same kind of pressure.
Leaning back.
Yeah. You see how you have to work very hard?
Oh, yeah. I
So-
can't even get in there.
Right. So if you get yourself a little bit above, and then, yeah, let your...
Is it okay for my knee to be against the table?
It
like
sure
this, or
is.
should- Okay.
Sure is. Yeah. And just let your heart go into your hands. If you'll forgive my new ageisms, but let your chest sink onto your hands a little bit. That will give you more weight. And are you moving?
Oh, that's right. You get a dorsiflex for me.
I am now.
You are now.
I
Good.
am now.
Okay, so from the lower leg, the next track is the upper leg, the hamstrings, going from the back of the knee up to the ischial tuberosity. We're going to show one technique here that I'm sure you have a lot of techniques for working the hamstrings. It's bringing an elbow or a hand down the hamstrings is not that imaginative, so I wanted to show you a few other things that might be new to your lexicon of working. So I've taken Kim's leg and I've bent it 90 degrees, and I'm going to support it somehow on my belly or my chest, or I could ask her to support it. And the hand placement here is crucial. I'm going to place my hands just on the inside of Kim's hamstring tendons. So there's the medial tendon, there's the lateral tendon. If I'm in any doubt, I can have Kim pull her heel to her back. Try to pull your heel against me there. Okay, so then I can feel the hamstring tendons very clearly. Now what I'd like you to notice about my hands, and now just relax it again, is that my hands are staying a good 1.5 inches or 2 inches apart. My fingers are not together in the back of the knee. I am well apart, going around the tendons to get that last bit of the hamstrings. Now I take the support away so that she's holding her leg up, and I invite Kim to slowly lower her leg. So the hamstrings are lengthening here in an eccentric contraction, and I am spreading the tendons and lifting away from the knee a little bit. This is a great piece for those who have hyperextended knees. And you'll see that I end up on the outsides of the hamstrings, having gone over. Let's just see that once again. Placing the knee, going just inside the tendons. Please do not poke your fingers straight in behind the knee. So my fingers come in and then they turn out again. So I'm hooking the tendons, coming out, and then Kim slowly lowers the leg. How's that doing for you, Kim? Is that
It's wonderful.
within the realm of tolerance?
Most definitely.
Okay, good. So I'm holding the tendons, and I'm holding them quite strongly, but I am not pressing really hard. And now I've just gone outside, and I get the ends of these hamstrings as she straightens the knee. And so we both finish up together. She's down on the table, and I'm on the outside of the hip. Okay, so Jeanette, support her, the ball of her foot on your tummy or something. And lean over. That's fine. Just enough to support it so it doesn't fall over. And find the tendons of the hamstrings. Yep. And slide your hands inside as if you were hooking around them.
Okay.
Okay.
And then I let go of her foot.
Kim, is that the same place?
That is the same place.
She got it? Okay.
She did.
So again, with your weight, you're going to keep that same pressure. You're going to take the support off of her, and you're going to encourage Kim now to slowly lower her leg back down to the table.
As I'm pulling the tendon.
You're pulling the tendons wide, and you're scooping them up a little bit. That's it.
There you go.
Yep.
Am I going a little bit too fast for the way she's
Yep, just a
lowering
little bit.
the leg?
Just a little bit, because you're going to be done before she is.
Okay. This hand felt a little awkward to me.
Okay, so let's just try it one more time.
Okay.
And you want to get inside those tendons, yep.
Okay, and then I want to get in them and then pull out.
Yep, and push down towards the table. Yeah, there you
Okay.
go.
Yep.
Good. Now, emphasize as you take the support away and she begins to lower her leg.
Yep. Can you lower your leg, Kim?
Yeah.
Certainly.
Your main thing for the first part is just to stay there. You don't have to do anything. She's stretching out from under you.
Yeah, I can feel that.
You feel that
Yep.
stretching away from you. So then, as that proceeds, then you begin to turn your hands out along the tendons.
Ooh, that one feels really tight.
So that's one of the things that you can notice with this technique is which of the hamstring tendon is the tighter of the two, whether it's the medial two or the lateral one, and that can tell you something about the relative tonus of the hamstrings themselves. All right, let's go on to another technique about the hamstrings. One of the things about the hamstrings is that they often work as a group when you're running. but when you're skiing or water skiing or doing anything that involves a side-to-side movement of the body, they work differentially. So it's good that God made the hamstrings separate, and it's good that they have a separation up between the two sets of hamstrings, and often people don't. And here's how you can test this. If you bend the person's leg up so that the hamstrings are relaxed, here is the division that we were just working with between the two tendons. As I move up, how far does that separation go up toward the ischial tuberosity where the hamstrings end? Well, with Kim, I can go about up to here, and then I can feel that the fascia that's holding the two hamstrings together is binding. When I say the two hamstrings, I mean the one lateral and the two medial. Actually, three hamstrings are being bound together, but the medial and the lateral ones are not separate, so that she can't use them separately. What does she use them separately for? She medially and laterally rotates the foot. The lower leg, I'm sorry. Which she can do when the knee is bent. And that's the motion that you can use to help you find how you're doing with this separation. So now I'm going to ask Kim to leave her foot cocked at 90 degrees, her knee flexed, and I'm going to let my fingers, all 6 of them, sink into this division between the hamstrings. So my 6 fingers are all right in a row, and I let those fingers sink into the 2 hamstrings, and then I'm going to go up and down, and like a hot knife through butter, let myself melt down through these layers of connective tissue between the hamstrings. And I might move up a little bit and let it sink down through also. Now, at the same time, I'm going to have Kim turn your toes in towards the other foot, medially rotate the lower leg, and then laterally rotate the lower leg. And what I feel is that first she contracts the muscles on my finger nail side, and then she contracts the muscles on my finger pad side. And that tells me that I'm right in the right place if I feel the muscles contracting first on one side, then on the other side of my hand. And I can just keep sinking through here to help the hamstrings have that separate function. And when I'm done, she can just put the leg down. Okay, Jeanette, you try this. So find right down near the knee, find the valley. Very easily, right?
Yep.
Okay, so follow that up to where you feel it isn't happening. Kim keeps her leg up.
Yeah, right here.
Right there, okay. So putting one leg a little bit back so that you can use that, let your weight fall through your hands into the leg, and let that melt down into the tissue while Kim really medially rotates her lower leg and really laterally rotates it, and really turn it in, and really turn it out. Does that feel similar, Kim?
Yes, it does.
Should my fingers be more at an angle like this, or should I be over her body?
You should
more?
be over her body, and your fingers are going pretty much straight down.
Straight down?
Straight down for the femur, yep. That's it. Good.
There's more depth with that movement.
Yep, that's fine. So before we leave the leg and go to the back, let's look at one last structure along this superficial back line in the leg, which is the sacrotuberous ligament. Here, just here, is the ischial tuberosity, and right up here is the corner of the sacrum, and running between them, if you feel right along here, you'll feel a hard bone-like bit at the edge of the gluteus maximus, which is the sacrotuberous ligament. Now, I'm not suggesting that you try to loosen the sacrotuberous ligament. That's not a good idea for the sacrum to be too loose. However, we can take the tissue that is connected to the hamstrings on the sacrotuberous ligament and just very gently, with the elbow, bring it down. So you hook I'm just lifting my elbow so you can see where I am. Hook on that tissue and bring it down, but it's much easier to do with the flat of the elbow, and you're not trying to loosen the whole ligament, but to feed the superficial tissue down into the hamstrings. Okay, so let that be the finish of the techniques on the legs for now, and we're going to switch now from the legs to the back, and we're also going to switch positions from doing table work to doing bench work. Okay, so in doing this work on the back, I'm employing a bench here that, it's an adjustable bench, which is desirable if you have it. I've set it so that Bill's hips are just a little bit higher than his knees, and I'm going to arrange his feet now so that they're a little bit in front of where they would normally be and closer together than he would normally keep them sitting in a chair like this. This is going to direct the force along the superficial back line as we do this work. But before we actually do the work, let's do an assessment. And to do this, I'm going to have Bill go forward one vertebra at a time. So just nod your head, Bill, and let your chin fall to your chest, and notice that stretch along the back of your neck. And now just letting your forehead bring you forward. You go forward one vertebra at a time, bending this one and this one and this one. And I'm noticing in this assessment, as I feel the spinous processes and as I watch the spinous processes, I'm watching where do they fan out, where do they get farther apart from each other, and where are they kind of clumped together like this one. I know that's pretty hard to see in a videotape, but it's a lot easier to see in life. And I'm just suggesting to Bill if he can lay his chest on his thighs, great. If not, great. But I'm seeing that bend, and again I'm seeing a whole clump of vertebrae down here that aren't moving relative to each other. So now this second part of the assessment becomes part of the treatment as well. I'm going to ask Bill to just drop your tailbone towards the chair, and then your sacrum, and then L5, and stack these up like a set of checkers, one at a time, pulling from the bottom, like those little toys that have a string. You pull down on the string and the legs and arms come out. Okay. Now right here he's having trouble stacking these up, so I'm just going to give a little assistance with my fingers, and coming up and stacking these up. Good. Okay, and then we got to there and he jumped to here. So, and if he'd continued with that, his head would have come up to here, which, as you can see, would have put his head in front of his body. We'd like to see his head come up on top of his body. So how can we help that? As he comes up to here, I say, now let your sternum put your head on. Remember what we did before on the superficial front line? Oh, now that's a little bit too far. Let's just come to where you're looking out horizontal or so. But that situates your head much more over your body. Okay, but that's not the extent of the treatment. We're going to actually apply our hands to the superficial back line here, and keeping in mind that we want the superficial back line to go down, I am going to once again conform the first phalange of my hands to his shoulders and bring that tissue down the back. Now, Bill, you're going to do the same thing. Let your chin drop and begin to let the weight of your forehead carry you forward. And feel your feet strongly on the floor. So your legs, that's it. So your legs are strong and your back is relaxed. Now, in this case, is going over your hair a problem?
No.
I don't know why, but going up that sensitive front is always more of a problem with hair than coming down the back. It doesn't seem to be a problem as much. So I am traveling over the skin, and if you see now, I am really putting quite a bit of weight down into his body. I'm even up on my toes to do it, but I am not working. Can you stay there for a minute, Bill? Would that be all right? So if I stand back here and I work with my muscles, you can hear it right away in my voice that I am straining. But if I lean forward and get my weight over his body, which you can see where my hands are now, and I just drop my weight onto my hands, he actually feels it deeper in his body, and I'm not sweating and swinking. I am not working hard. I worked hard for enough of my life. This is it. I'm going lazy. So, no, the point is not to be lazy. The point is to be sensitive, and if you're using your weight, you can be sensitive. Okay, now Bill, come on back up. And again, we're stacking this up. And we find those little guys. Don't go too far ahead here. We'll just find these little guys and we'll let them come forward as you stack up. Let them, that's it. Arch just a little bit right in there. Good. And as we come to the top, don't forget the sternum bit. It lifts to lift your head on. That's it. You don't have to come too far back. Just let your head float right up. Lovely. So a variation on this, you saw me doing this with my hands. You can also do this with elbows, with those whose back are a little more recalcitrant, or if your fingers are running out of steam. Okay, so once again, Bill, I want to feel your feet coming back at me. Right, so your back is soft, your neck is soft. Well, your neck is soft at this point. Everything that I've gone by is soft. Is that too much pressure, or is that okay?
That's fine.
And just let yourself slowly go forward. This is the same motion of each vertebra going down. And I'm just leaning in with my elbows, and because I have eyes in my elbows, I'm listening for where are the tough spots. So I just found one over here, so I'm going to stop for a moment. I'm going to have him, you push back to me from your feet. That's it. Not from your back, but from your feet. Your legs are strong. Your back is long. Okay? You feel that little spot in there? Yeah. You can even lean to the left with your head to stretch that out. Feel that pulling? Mm-hmm. Yeah. So you use your little stretch right in there to make this more. Good. Okay, come back to the middle. And let's get on the train again and keep on going down. Let your head relax, just vertebra by vertebra going down. And you'll notice that I'm not on the point of my elbow. I was working with the point of my elbow a minute ago to get that particular spot. But now I'm working with the flat of my elbow. So I'm covering quite a bit of area in his back. So even though I'm leaning into him with a good deal of my body weight, I don't think it's hurting him because it's distributed out over a fairly wide space. And I can carry that in people who don't have, if somebody feels pain when they're doing this, and you don't want to put a lot of pressure on their lower back, but if they are not and the low back is strong, you can go right on down to the sacrum with this move. Okay, now we've seen going down the back what we call back stripes in our school, going straight down the back. We've been working that way. But we need to add a little wrinkle to this. A little difficult to see in the video here, but if you look right in here, you will see a shadow that represents where the spinous processes of the vertebrae are below or deeper than or more forward than the surrounding erector spinae muscles. Well, let's make it simple. We'll call this a valley. And if you look up here where it's bright, it may be a little hard to see on the video, but the spinous processes are protruding farther out than the surrounding. They are higher or further back than the surrounding erector spinae muscles. We're going to call that a mountain. So the mountains are where the spinous processes are above the surrounding muscles. The valleys are where the spinous processes sink between the muscles. And what we're going to add, we're still going to be going down, but as we go down the spine, we're going to pile up on the mountains and we're going to dig out the valleys in our quest to make the spine longer and more balanced and freer. When the spinous processes go deep, the muscles come too close. So we're going to dig out the valleys by moving the muscles away from. Where the spinous processes stick out above the erector spinae on either side, we are going to pile up on the mountains, because the tendency is when the spinous processes stick out, the tissues around them go wide. So now I'm going to do the same thing that I was doing before, but we are going to add in this idea of the mountains and the valleys. Be aware that you read the mountains and the valleys when they're sitting on the bench or standing. You don't read the mountains and the valleys when they're leaning over. You read it beforehand, you remember what you saw, and you work based on what you saw when they were sitting or standing. So now in doing this technique, taking into account the mountains and the valleys, I'm going to do the same, the client's going to do the same thing, taking the chin towards the chest. Let your arms go outside your legs if you would, and begin to roll forward vertebra by vertebra. Now, these are where the mountains were. There are more mountains now. The spinous processes are sticking out, but I believe what I saw when he was standing up, which was mountainous anyway. And as I work down the back, I am working to bring the tissue in. So I'm actually grabbing the erector spinae. We don't use words like grabbing. I'm contacting and getting a hold of the erector spinae, and I'm bringing them in towards the back. And continue down a little bit more, Bill, if you would. So right here is where we got this transition point between the mountains and the valleys. So now this doesn't look so much like a valley anymore, because he's bending forward, so the spinous processes are coming back. But I believe what I saw, and I work in terms of what I saw when I was standing up. So now I'm going to work down and out. I'm going to go right in. Of course, I'm not pressing on the spinous processes, but right beside them in the laminar groove, and I'm taking the longissimus and iliocostalis muscles, and I'm moving them laterally away from the spine in these inverted V's. And Bill just keeps, the client just keeps going forward vertebra by vertebra, and you can remind them to stay in contact with their feet. You can remind them to feel that both sits bones are on the bench in the same way. You know what? We didn't talk about it, but way down here at the bottom of his back, he's got another set of mountains. So right down at the bottom of his back, I'm going to bring that tissue in again. So pile up on the mountains, dig out on the valleys is the rule, or a useful rule for working on the superficial back line and the erectors. And just, that's great, just let your shoulders relax now. Good. so many people do is come up to here, and then they bring the head up to look forward. See where that leaves Sunshine's head relative to her torso. And so what we did was we came up to here. She was stacking things up really nicely. And then when we get to here, she's beginning to stack the thoracics up. Whenever you see somebody start to move their head, and just put your hand on the sternum so they feel the front and the back. Your back hand drops down and your front hand comes up. Use the sternum to put the head on, which creates the head in a very different position. Person with a very different feeling. Although we've been doing the back work on the bench, of course it's possible to do back work on the table. Most everybody does that, but when you're doing the structural back work, it's not really as advisable, but I do want to show it in case you have somebody who, for one reason or another, can't do the bench work. However, it comes with a couple of provisos here in doing this work. You obviously could put the face in a face cradle. I choose to have the feet over the end of the table. So I'm going to start here in the mid-thoracics, or the upper thoracics rather, and again I'm using with my knuckles together this whole surface of the first joint of my hands and not using my thumbs, and then just letting my weight sink into Kim's body. Is that okay, Kim?
Yes.
And my travel is then down her back. I am not pressing at all on the spinous processes. You see the little opening there, so that I don't press on the spinous processes, but I am bringing the tissue of the superficial back line down, since that's most often where it would like to go. And I can continue this several times, and when I get to the bra line in the female of the species, I will just stretch that down a little bit and then come back, pick it up, and continue down the thoracics. Now, as I get to the lumbars, I'm going to say, Kim, just slowly breathe in, deeply and slowly. Keep breathing in, keep breathing in, keep finding some more room for that air. Bring more air in, bring more air in. Don't lock your throat, don't lock at the top of the breath, just keep breathing in, and now you can breathe out. The now you can breathe out came as I reached her sacrum. And why did I have her breathing in? As she breathes in, she increases the intra-abdominal pressure and supports the lumbars, because I don't want to be pushing these lumbars forward when I'm going through here. So, how did that feel, Kim?
Wonderful. A very lengthening sensation.
Good. Now, why did I have her breathe in? About the time that I get down here to the 12th thoracic, if I were to keep this pressure going and she were not breathing in, I would be, let yourself breathe out, I would just be pushing these lumbars forward and compressing them, and that would not be a good idea. So I want some support for the lumbars. So if, when I'm here, I just say, now start slowly and steadily breathing in, she will, by means of the air pressure, increase the intra-abdominal pressure and support those lumbars, keeping them there. But I don't want her to lock her breath. I don't want her to go and hold it. So I just say, keep finding a spot, keep finding a place to stuff that air, and now let it out. Because now you see I'm on the sacrum, so it doesn't matter anymore. And she lets out a breath, and I'm able to work along the sacrum. This is a nice way of working the back, but I must say it is not as effective as the bench work. So I would use it only in those people. I would use it as a nice way to smooth things out, or I would use it in those people where the bench work is not possible. If you, for some reason, don't want the client to be active and want them to be passive, Kim, could you just pick yourself up here? It is, of course, possible to support the lumbars on any of a regular pillow or any of the kind of body pillows. Although the back work that we've just been doing has taken us up to the top of the thoracic spine, we haven't yet done work with the neck and with the scalp itself, because although the muscles come up here to the top of the neck, the fascia continues right up over the epicranium onto the forehead. although we won't be doing any work on the forehead, we will be doing some work here with the scalp. If you feel above the occipital ridge here, you will find up onto the scalp, especially in those people who have a forward head posture, that the fascia has glommed up. That's a scientific term. Has glommed and built up on the back of the skull in the gallia aponeurotica, or the scalp fascia. So if you find one of those ridges of fascia here, which you can find with the tips of your fingers, if you melt gently but firmly into that and then bring that tissue down, you have to work very slowly here. There's no, oh, there might be a little bit of occipitalis muscle, but there's hardly any muscle here. So it's just a matter of letting this melt down and flow down. And the same thing applies that we saw when we were working on the hairy man, that we don't want to have our fingers travel over the hair. For some people, that's going to pull on the hair. So you just take a bit of skin, bring it up, go into the tissue and bring it down. You might find several ridges along the occipital bone here that you can catch and bring down. You'll feel the tissue in front of you like a wave melting. You'd be surprised at how much this work on the epicranial fascia can affect the whole superficial back line. We're so used to thinking about muscles and lengthening muscles, and there just ain't much muscle up here, if any at all. But by working down on the fascia of the epicranium here, down towards the occipital ridge, down towards the nuchal ridge, you can really get a lot of release down the back, down at the sacrum, and you'll find that that's a worthwhile thing to get in your repertoire if you have just been working the muscles of the back. So our bench work took us up to the top of the thoracic spine, but didn't take us into the cervical spine. So your end game work at the end of the session, where you are urged to work on both the neck and the lower back, because these are the freestanding areas of the spine and the ones most likely to give you trouble after a soft tissue structural session. So it's a really good idea to melt what you've done into the neck. In this case, we want to continue the work of the erector spinae that we were doing on the bench up into the neck. So if I support the head on one hand so that Kim's head is just comfortably resting into my hand, and I bring my fingertips underneath the erector spinae, I can continue lengthening these out in the direction of the head. And I wouldn't hold you to that direction. It's quite possible to put your fingers up under the skull gently and to take that tissue down. Is that pulling your hair, Kim?
No.
It's okay? And just stay with the erector spinae as you go down, not going off onto the trapezius like this, but staying with those central cables that run up in here. And of course you could be doing that on the other side as well. And then you can reach under with your hand. I'm now supporting the head with my other hand, reaching under. If you can see my fingertips, bringing those fingertips right up the laminar groove, but with a right up against the spinous processes, not pushing on the spinous processes, but pushing up, meaning up toward the ceiling, up into her neck, along between the spinous and the transverse processes. And watch how slowly my fingers are moving, because I'm giving her time to melt on top of my fingers. And of course we'd want to do that on the other side, but for the video here I just want to give a third technique. I'm going to cup Kim's head in the palm of my hand. That leaves my fingers really going down her neck. I'm now going to curl my fingers back 180 degrees, and that allows me to bring my fingertips very gently, very swimmingly, gently up under her skull. Now, you notice the direction of my fingers is coming toward her skull in a superior direction. This is not the typical OA release where you come up under the space between the occiput and the first vertebra. You are bringing your fingers back towards the occiput, so they are, if I can get my thumbs out of the way, curled exactly 180 degrees. Then I just very gently bring my hands toward me and towards the table. Do you see how my hands are going down into the table and towards me and down into the table and towards me, presuming that your table is soft enough to allow you to come down that way. Okay? And you just go as long as that goes, and then you let the person have their head back, and you can repeat that a couple of times. Again, my thumb would be naturally up, but I'm just putting it down out of the way so you can see my fingers up onto the skull, and then down into the table, up towards me, down into the table, up towards me. And you watch the angle of Kim's head slowly getting some length here in that suboccipital region. I'm not saying that doing the usual OA release is bad or anything like that. This is just an alternative to that. And what I'm looking for here at the end is a nice mobility in the neck, which Kim has, and length to the back and general ease. Okay, so after you've done the neck work, often the final thing that you'll do with the session is to ease out the lumbars and the sacrum. So I have brought Kim's heels close to her rear end, and I'm going to ask her to just tuck your tail under and lift your pelvis up in the air by pushing down on your feet. And I'm going to put my hand under her pelvis and right up the lower back, and now lower yourself back down onto me. Come right down onto the hand. And I'm going to ask you just to roll to your left side so that people can see where my hand is. So that 2 fingers are on one side and 2 fingers are on the other side of the spine, and her spinous processes are here in the groove between my 2 middle fingers. Then I better keep this going. I'm just going to hook my fingers, hook the first joint of my fingers like this, so that when I'm pulling down, I'm bringing that tissue with me. But it doesn't take a lot of strength on my part because, of course, her weight is right there. So as Kim lets herself down, there's the 3rd lumbar, there's the 4th lumbar, there's the 5th lumbar, and now I'm moving along the sacrum. The trick with this move is to pull directly towards her feet and not to pull her towards me. So come down onto your feet and up on your pelvis again, and I'm just going to bring that tissue down with me, and I just need to be careful to bring it straight between her heels and not towards me. And when you get down to about the underwear, or sometimes you can pull it down a little bit, but down onto the sacrum, you're done and you can let go. How's that feel?
Very nice. Nice finishing touch.
Yeah.
Mm-hmm.
If you let your legs down now,
Mm-hmm.
you notice your lower back stays pretty much on the table when you let
I
it down?
do.
Yeah.
Quite noticeable.
Great. Okay, well, that's the last of the techniques for the superficial back line. We hope you've enjoyed this tape and that you will consider looking at the other ones that we have on the different lines. And thanks for listening.